because of the day that I found out I had a fibroid. And I only found out not because I went to seek help. Remember, I was in pain, heavy menstrual bleeding for 23 years. I didn't seek help until I decided I wanted the time. And that I had a 10-centimeter fibroid within my uterine wall. And so, it took 23 years of pain to only find out when I went to seek out motherhood. And that's the problem, isn't it? That we only usually discover our problems or the conditions we're holding when we're trying to conceive. But we know that we're more than reproductive making machines. We don't seek out answers, as our doctors have said, when we're bleeding through meetings, through missing work, and suffering months after months. And so in my experience, I started to ask the question, why did it have to take wanting a child for me to find out that I had a 10-centimeter fibroid lodged in my uterine wall? And then secondly, even though I was abroad, I'm still very much a SierraLeonian and I have a green passport, I'm African, so I'm looking for African data. There was none, and that was 4 years ago. The landscape and the discourse and the research around uterine fibroids was very lean, very small clinical studies, nothing robust. And you can't solve for what you can't count. And so, we know, as the statistics have been said already, 80% of all women are most likely to get a fibroid, but it's much more aggressive and a lot more delayed among Black women. And it takes about 7 to 10 years before we get diagnosed with conditions like endometriosis, which if you have the experience or you know of it, is absolutely life-altering. And once again, where is the investment? Where are we, when we talk about reproductive health, we forget the other part that's beyond maternity. The numbers continue to tell a devastating story. I will not repeat them. But what I will say is that while millions of women continue to suffer, African women continue to suffer from reproductive health conditions, the current data, global data, shows us that we just spend $6 per woman annually, and we actually should be spending $22.50 to be able to provide comprehensive care. And so when we think about a funding gap, we're also thinking about a dignity gap. And so these questions is what's really carried me on this journey. And that is what has birthed and continues to shape uterus health. The questions I have, the stories you've all been telling us over the last 2-3 years. And so we're responding to this gap. I think with a lot of audacity, sometimes I have to pinch myself. I'm like, how are we even doing this? But we must, and we will, and we are doing it. And so our model works in 3 pillars. 1, a digital platform that guides women from symptoms to care. But we're not just going to create an app because it's sexy to create an app and you get money that way. The app must speak to women, our needs, our nuances, the way we need to understand our pain. The heart of what we do is our campaign, The Voice. We're starting data from the narratives of African women, not from clinical care or not from some abstract systemic review or whatever. It really is just asking women, what is killing you? Where is your pain? And what do you need? And then third, because we're thinking about this holistically, because women told us, we did not come up with this solution, it was women that said, when we finally get diagnosed, we also get priced out of care. And so it is with that that we developed and are developing the Uterine Health Fund. My sister of 20 years, background in engineering, oil and gas, is the one, she's the current CEO of Uterus. We're able to pull her in. She's going to talk a lot more about the fund. And it is an honor to walk this journey with her because she has all my secrets, so we must keep her in this company. So, this fund isn't just another project. It has the potential, actually, and the ability to be a scalable platform designed to embed uterine care into the national health systems. We're not here to duplicate, we're not here to take credit, what we're here is to add into pre-existing structures because that's how you think about sustainability. So, Honorable Minister, we'll be circling back to your office. It also aligns with public insurance, it generates information and evidence for reform, and it ensures that women get care that is timely, that is affordable, that is dignified. But let me be clear, when women are healthy, Africa rises. Every woman who gets treatment returns stronger. Every data point that is ours makes the next woman's journey easier. Every story changes what is possible. Today we stand on the shoulders of every woman who came before us, of the doctors who have sacrificed to ensure that women in our country are safe. Today, we say no more to pain. I hope we're saying no more to pain. And to the women of Sierra Leone and across Africa, uterus health, please let me tell you, it is yours. Your stories are our platform. Your health is our mission. I want to conclude by just really being in a space of gratitude. I want to thank our partners that are here and the ones we're going to develop, because you're now our besties, all of you sitting here. Thank you for seeing that investing in Africa's future starts with investing in African women. To our uterine health partners, founding partners, the Women's Place, Graceland Clinic, Graceland Diagnostics, and Community Response Group, you are true pioneers. It's just one SierraLeon sister of yours calling you and saying, we want to do this, and you all joined and you're developing the vision. Thank you for walking this journey to ensure that we get more women screened across our country and we're able to give them the surgeries that they so desperately deserve. I think sometimes it's very easy to say that our healthcare workers, there are challenges, aren't doing enough, or we don't have the most qualified, but the ones we work with are some of the best human beings. They're clinicians, they're your best friends. They hold space for psychosocial support, they pay out of pocket, they stayed in their country, they didn't go anywhere. So thank you, Dr. Francis Uri, Dr. Valerie John Cole, you're somewhere there, you're so brilliant. Thank you, Dr. Mengor, I don't know if he's here, and then Auntie Safia Tutunis, thank you for doing community engagement. And to our distinguished guests from Nigeria, Honorable Dr. 𝐏𝐢𝐳𝐬𝐜𝐿, Chief Mr. Tonte Ebre, thank you for being here. It means a lot. At the end of the day, this is a continental movement. It's a SierraLeonean catalytic vision, but it is owned by all of us. I thank you for walking this journey with us. To the office of the First Lady, you know, the sign of true leadership is the team that you have among you. And Her Excellency has some really beautiful gems. To the Chief of Staff, Mr. Saluteka, to someone I just found out is my uncle, he doesn't want me to say this and he's rejecting me, but Mr. Momoture, very recently we realized we're family, but he's not claiming it. I thank you for being able to walk this journey with us. Building Africa's uterine health company won't be easy, but we start when we listen to each other. When we set to women to draw the roadmap of where we need to go. Uterus is more than a company. It's a model where stories become data, where data becomes policy, and where policy becomes the care that every single woman deserves. And so together, we can build what should have always existed. Early, accessible, dignified, uterine care for every single African woman. And that's thank you. A round of applause one more time for thank you so much for your vision, your voice, and for building something that reminds us what's possible when African women take the space to lead, to innovate, and to create our own solutions. And as Fatou has said, this is an African movement, and as we know, movements do not thrive in isolation. To scale impact, we need solidarity, we need organizing, and to make sure policies move from paper to practice, we need fairness advocates on the ground. Our next speaker has spent over 15 years doing exactly that. Chief 𝐀𝐟𝐫𝐢𝐜𝐚'𝐬 is the Executive Director of White Ribbon Alliance Nigeria, an organization that has redefined what movement building for maternal and reproductive health can look like. It has led citizen advocacy that helped shape national laws, train midwives, empower communities, and ensure that the dignity of women is not a footnote, but a frontline priority. He's a strategist, a coalition builder, and a traditional chief. That's why we call him chief. And he's a leading voice for health accountability across West Africa. Please join me in welcoming Chief 𝐀𝐟𝐫𝐢𝐜𝐚.
Your Excellency, the Honorable Minister of Health, and distinguished ladies and gentlemen. First of all, let me also recognize the presence of the delegation from the Nigerian High Commission in Sierra Leone, led by the head of Chancery. Please, can you rise for recognition? You're welcome. Your Excellency, in Nigeria, we have this notion that there is no free lunch anywhere, not even in Freetown. And so I came expecting that there is no free lunch. And then the minister all of a sudden mentioned that we've been sharing free menstrual pad. And Plateau has taken on your footstep to also launch the literary fund to provide free services for women with visual health conditions. So I'll go back to Nigeria and inform them that indeed there is free lunch in Freetown. And somebody also talks about the position in 𝐿RRIGHT for the person who needs to explain further. For our mothers over there, they need to know what 𝐿RRIGHT is and be proud of who the first lady is. Then talk say, we have plenty presidents' wife in Ghana. They're going to do election. And your first lady for SierraLeone was elected the first president. So please put your hands together for very quickly, today, we can come on. Yes, today I would like to share some of the work that we have done as 𝐀𝐟𝐫𝐢𝐜𝐚 Nigeria. The White Ribbon Alliance is a global movement. We have membership all over the world. But then we also have national alliances across Africa, Asia, and the Middle East as well. Next slide, please. Okay, so today I want to talk about why advocacy is very important. Advocacy is important because too many women in Nigeria are dying during childbirth. About 512 out of 100,000 live births, and according to WHO estimates, this number will be higher. As much as 1,065. That is a very big number in Nigeria. These deaths are preventable and are often caused by problems like not enough health workers, poor funding, and delays in getting care. Advocacy helps push for solutions to these problems so that more women can survive and thrive. So who are we as an alliance? The White Ribbon Alliance Nigeria has been speaking up for women since 2009. The Global Alliance was formed in 1999 globally, but in 2008 we officially registered as a national alliance, although we've been operating as a coalition before that in River State. We make sure women's voices are heard when decisions about their health are being made. As part of the Global White Ribbon Alliance, we work with others around the world to bring positive change to maternal health in Nigeria. I would like to also share a bit of what our Respectful Maternity Care campaign was. Every woman deserves to be treated with respect when giving birth. It is a basic human right. Our campaign around RMC promotes respect, consent, and privacy during childbirth. We fought against abuse in health facilities and pushed for systems that put women's needs first. And so far, I'm glad to inform you that over 20 states have trained their health workers on respectful care in Nigeria. And then we did not stop there. We also organized a What Women Want campaign. Pato was talking about the needs of women, listening to them and knowing what they want. So in 2018, we launched a campaign to hear directly from women about what they need in maternal care. Over 78,000 women in Nigeria shared their views. Their top priorities included the same respectful maternity care that I talked about. If they are not respected, if they are treated badly, it could encourage them, it could discourage them from seeking quality health care. And they may not be able to go to better health facilities. So respectful care was the top priority. And then in Niger State, we focused on water, sanitation, and hygiene, because that also came on as a result of our What Women Want campaign. And then we also observed that for religious reasons, some women prefer to be attended to by trained female health workers during antenatal service, not male health workers. So that also was a priority, and we pushed for the government to take action. And so, as part of our Ask Listing, Ask campaign, some of these things were also addressed. So, Pato, this is very important, and I want everyone to join me. Please say ask. Ask. Listing. Listen. Ask. Ask. So these are the steps we took. Our advocacy starts by asking women what they needed. We listened carefully to their voices and collected stories through trained mobilizers. Then we advocated for the government to act, and on this data to make changes. So as a result of the action that we took, in Niger State, about 100 more health workers were trained and deployed to some of the healthcare facilities. And that takes us to social accountability. Today, in Nigeria, we have something we call the Basic Healthcare Provision Fund. That came as a result of the commitment of 1% for our consolidated revenue fund to health. We have to make sure that that fund is tracked and utilized properly for the benefit of women. So in Niger State, that same Niger State, which was our priority state at that people and leaders together. Imagine women sitting with their government officials talking about the quality of service they are receiving from their health services. And then in that case, a lot of women came up with a lot of complaints about how they were treated, how some of them, their toilets are bad, and because the place was smelly, they could not utilize the facilities. I remember a community called Maito in Shishi local government area of Niger State. A new health center was built, but because the governor didn't have the time to commission it, they could not use that health center. Meanwhile, the old one was overtaken by bats, so they were working under a tree to attend to women. But as a result of this accountability movement, the governor listened, and even though he didn't have time to commission, they were able to open that health center for women to make use of. So sitting with government, holding them accountable helps. It makes them understand how important these needs are and how to address them. So what have we achieved so far? What are the key outcomes? Because of our work, people's voices are now included in health decision making. We've seen better health budgets and facility improvements that match what communities ask for. Let me also commend Dr. 𝐀𝐟𝐫𝐢𝐜 here. She's one of the first commissioners of health in Rivers State, a state with a population of 9 million people, to commit funds for family planning as a result of our advocacy. So advocacy is making health services more responsive and transparent. Now, what lesson do you have as SierraLeon to learn from some of these initiatives? SierraLeon can use our Ask Listing, Ask model to improve women's uterine health. We can run a What Women Want survey to understand key issues like menstrual health and diagnosis. Community talks and citizens' feedback can guide actions. And finally, these steps can be built into national health programs for lasting impact, just like our Honorable Minister said. Thank you very much, and I look forward to working with you. Thank you so much.
Thank you very much, Chief Ibrahim. Please give him a warm round of applause one more time. Thank you for showing us how movements are built from the ground up and how accountability must begin with the people we serve. We actually have an overflow in the hall, and some people, instead of going home, have just made their way upstairs, and we just want to recognize and acknowledge your presence and appreciate you for making it and staying. And we also say thank you to Mr. Ruri of New Brookfield Hotel for giving us this beautiful venue. So our next speaker, Chief has already alluded to her. She is another speaker from Nigeria and a formidable voice in the health system itself, as a public health champion, but also a transformative leader, reshaping what healthcare looks like at the state level. She's the Honorable Commissioner of Health in Rivers State, Nigeria, and her career spans more than 2 decades across clinical care, national policy, emergency response, blood services, and health system innovation. In less than a year as Commissioner, she has introduced emergency services, revived health insurance, expanded specialty care, and accelerated accreditation across state hospitals and training institutions, all while advancing a bold vision for dignified, accessible care for every Nigerian. Please join me in welcoming the remarkable Dr. Adaeze Ori.
For a minute there, I was wondering who she was talking about.
Your Excellency, the First Lady of the Republic of Sierra Leone, and the President of Ohlad, Dr. Fatima Ada-Diop. Honorable Members of Parliament, Honorable Ministers of Government, the diplomatic community, and the high-powered delegation from the Nigerian High Commission. Paramount chiefs, spiritual and community leaders, civil society, advocates, partners, the Executive Director of the White Ribbon Alliance Nigeria, nurses, beautiful nurses in the room, young girls, women, members of the fourth estate of the realm, distinguished ladies and gentlemen. It is with a great sense of honor and privilege that I join you today all the way from Rivers State in Nigeria, standing in solidarity as a landmark initiative to transform the health of women and girls on the African continent with the unprecedented launch of the Uterine Health Fund right here in Switzerland, the Republic of Sierra Leone. As a specialist family physician, something has always bothered me about the way reproductive that affect millions problems. Remember, at the time, I was also something that wasn't bothering me. It didn't affect my childbirth, and so I learned to carry it.
all the way in Aspen, Colorado. I almost fainted in my bath. And my husband rushed me to the hospital, and those non-eventful I suffered very heavy bleeding that time, and my prayer was, God, please let me not enter the hospital. Let me make my way home. And I returned home, and I had surgery to remove the fibroids. They were about 9 in number. And I was told it may recur, of course, from the training, to expect that it may come back. And less than 4 years after that, I had to have a hysterectomy for the same fibroids that were now 22 in number and almost the size of my entire uterus. The greatest weight of this burden lies on our women. Black women, African women, occurring at rates that are almost 3 to 4 times greater than in other races. Sometimes even presenting right after the onset of menstruation. Due to the lack of knowledge, lack of access to care, and late presentation, many women on our continent suffer morbidity and oftentimes higher rates of death from thyroid disease and the interventions that are meant to address them. Many of them will end up prayer houses or local health services who may have good intentions, but they are untrained in fibroid management largely, and so many women die every single day due to complications associated with body management. Amongst most of our women are beautiful in this continent. Delayed presentation before evaluation and self-proclaimed miracle workers, spiritual professionals for the cure of fibroids, and even fake news, to mention a few. It is a common occurrence to see African non-pregnant women presenting with huge fibroids, almost appearing as though they are advanced in pregnancy. They note that their clothes don't fit anymore, and people even ask them highly embarrassing questions. I when you begin, they come. Some even cannot conceive due to the fibroids and are labeled by family members, neighbors, and peers as infertile, even callously referred to as men. To hide their condition, many women will not seek medical attention in order not to impede their chances of marriage due to the attached stigma. Some women are driven away, ostracized, abandoned, and divorced due to their inability to conceive or carry a child to full term. Why today stands as a watershed moment for companies the way they approach women health is because we are committed to seeing women in their entirety and addressing their health issues in their wholeness, whether or not pregnancy and childbirth is involved. A woman's worth must not be regarded as valuable only to the extent of her baby carrying capacity. In Rivers State, under the leadership of His Excellency, Governor 𝐂𝐟𝐫𝐢𝐜𝐚, we have been determined to address women's health through a more holistic approach, with a person-centered and community-oriented view of health needs and not a disease-focused approach. And these are a few ways we have begun to do this, sharing our experiences and positive outcomes nationally and regionally to inspire and provoke much-needed reform. We increased government investment in productive commodities and distributed to over 400 healthcare facilities. We've trained community health providers on counseling for women's health needs. services to where they are. Introducing gynecological and obstetric ultrasound scanning in all 350 primary healthcare centers in Rivers State. And interestingly, introducing mental health care services in all 350 primary healthcare centers in Rivers State. We've employed and trained 2,000 frontline healthcare workers in the state, bringing our state's health workforce in Rivers State to 7,992. We've renovated and upgraded about 180 primary healthcare centers with emphasis on water, sanitation, and hygiene facilities through state government investment and partnerships with the World Bank and the National Primary Healthcare Development Agency through the Basic Healthcare Provision Fund that was earlier mentioned, and which I was proud to contribute as an early advocate for the design and conceptualization of that fund in Nigeria. We strengthened referral services by upgrading cottage, general, and zonal hospitals to cater to the needs of clusters of primary healthcare centers that need to refer cases for surgical intervention and management of complications. The Honorable Member of Parliament, Honorable Mariama Zongo, I see you and I salute you. God bless you. Thus, building capacity in our local communities and lightening the load on our state's teaching hospitals so that we free them up to pursue advanced level research and innovation. We revitalized the Rivers State Emergency Medical Services, working across all communities in the state, and collaborated with academia to design innovative approaches to providing school healthcare services for school children aged between 5 years and 17 years who we acknowledge are often underserved because their attention is almost always on the under-5s. We partnered with the Ministry of Education to equip and staff sick bays in our state secondary schools for girls with linking them to private centers and community hospitals for state-funded health services for uterine health and other health needs. As someone who was a teenager with very severe and heavy menstrual bleeding, very painful, that would leave me debilitated for 36 hours exactly. I counted. It was 36 hours. Like magic, after that 36 hours, I would be able to function. And so sometimes it would be at home, or it would be in school, or even in the university, because it followed me into my early adulthood. I learned to work with 4 sanitary pads at a time. So imagine if secondary school girls have access to 24 hours nursing and counseling services that can help them navigate and address some of these conditions that need further care. We digitalized and strengthened the state's health management information systems for evidence-based learning, planning, and decision-making. And we are, of course, for the inclusion of uterine health in our essential care packages with the Rivers State Contributory Health Protection Program, our state health insurance, and working to get reusable sanitary hats or cups that we will distribute throughout the entire state to reduce the cost of menstruation. Those sub-Saharan women bear the greatest brunt of uterine health conditions. Africa has not leveraged opportunities such as cross-country collaborations and the benefits of South-South learning. I find myself deeply connected to my Excellency, Dr. Fatima Madam. Perhaps because in Rivers State we also have a region of maybe it is simply because of her fierce and unapologetic commitment to bringing transformational change for our women and girls. Your Excellency, Your dedication to advancing health and well-being on our continent is commendable. And your courage in bearing the torch and shedding light on this most ignored set of health conditions for women and girls is truly inspiring. It is therefore with great honor for me to be part of this launch of the Uterine Health Fund, which is a rousing call to action for all African nations. As we gather here today, we do so with a shared commitment to confront this challenge head-on, with the goal of alleviating the heavy burden that uterine health conditions place on our women, our girls, and our communities. Let us all be reminded that we are not just here to discuss the problem, but to forge solutions and march boldly forward with action. This fund will have a profound impact on the lives of countless African women and girls. This launching is not just an event, it is a call to action. We therefore commit to Your Excellency and Uterus Health to collaborate in ways that will lead to meaningful change. Together, we can rise to the challenge that is before us. Together, we can build a better future for our women and our girls. This focus on uterine health is not a project. It is an ideology. Congratulations, Your Excellency. Congratulations, Madam Batu. Congratulations, Uterus Health. Congratulations to the Republic of Turkey. Congratulations to the African continent. May the Almighty bless you. Thank you.
Remarkable Dr. Ori. Thank you very much for sharing your story and for showing us what both leadership with vision and execution looks like. As you said, this is a call to action for all African nations, and this brings us to the heart of the matter, the Uterus Health Fund. What is it? How does it work? Who does it serve? And why is it the first of its kind? But before we get into this introduction, we begin with a short video that gives us a window into the house. Please fix your eyes on screen and watch this short video before I introduce the next speaker. My name is Asubri, and I am the founder and CEO of Uterus Health. The first thing my mom said to me is that she is tired of being pain. I felt like nobody would listen to me. So mommy is obviously so mommy is saying they don't give me coming. I started having difficulties with my menses. It started coming heavy. It was so bad and painful. Yourself. Just for yourself some more, because sometimes we forget that we exist as women. If my mom could speak, she would say, I deserve care, I am cared for, and in that, I'm also free. I love you and I always love you when you enjoy life. Thank you.
These stories are rare. They are just rarely heard. But silence does not save lives. Awareness saves lives. Care saves lives. The Uterine Health Fund is much more than a launch. It is a blueprint for care. Uterus prioritizes what women actually live with, and we lead with lived experience. Uterus is the first digital platform and fund focused solely on uterine health for African women. The Uterine Health Fund is also a financing mechanism built to subsidize diagnostics, surgeries, and ongoing care. The launch launch of the Uterine Health Fund marks a turning point. This is more than a campaign. It is a commitment to make uterine health is an urgent and prioritized